Hi guys, Assalamu alaikum. We're gonna start a completely new section, health psychology. So yeah, all right. Health psychology is a bit different than the क्या कहते हैं, other areas of psychology that you guys might have studied. ठीक है, abnormal, organizational does not matter. Um, Same thing, five topics, right? There are five topics that you have to go through to complete health psychology. Uh, these two topic, pain and stress, right? These ये दो topic ऐसे हैं which might be similar to abnormal psychology, as in इसके अंदर questionnaires वगैरह भी हैं, the same thing जो abnormal psychology में ज़्यादा होते थे. uh, Health promotion वाला जो chapter है, that is gonna be more friendly towards people who have studied organizational psychology. क्योंकि इसके अंदर दो स्टडीज ऐसे हैं जो आर रिपीटेड इन ऑर्गेनाइजेशन साइकोलॉजी, तो यहाँ पे थोड़ा सा रेपिटेशन आती है, तो you don't have to study for some things again. Patient practitioner and adherence, right? These are introductory topics. थोड़ा माइंड मैपिंग की जरूरत है because the structure of health psychology ठीक है थोड़ा बहुत differs from organizational and abnormal psychology. You don't have dedicated sections name, right? हर chapter के अंदर हर दफा section का नाम अलग होगा, right? It's not fixed, so it varies according to chapter, right? So again, when you're practicing for your CIEs, whatever, हमेशा याद रखना कि ये section chapter के अंदर section 1 का नाम क्या है, section 2 का नाम क्या है. So yeah, chapter para patient practitioner relationship, and the first section is the interpersonal skills, right? That's gonna be the first section. So what this topic will tell you about is uh, how does interaction happen between a patient and a practitioner, right? Doctor patient के अंदर how does communication happen? Verbal communication किस तरह होता है? What messages are you giving through verbal communication? What messages are you giving through non-verbal communication? And what message you should give, right? That's the first section. Second section is TCAP. In the interaction between doctor and patient, uh, how many different styles of doctors can you find? As in, how many different styles of communication can a doctor engage in with a patient, right? So different styles of communication. वहाँ पे आएगा. Uh, is he क्या कहते हैं, strict? Is he lenient, etc. Things like that. And thirdly, ठीक है ना, you will also find क्या कहते हैं, um, errors made by doctors taken out. So in the third section, you're going to talk about errors made by doctors and whatnot, but and how to improve our adherence overall. So patient practitioner relationship, right off the bat, they ask you by what is meant by patient practitioner interpersonal skills. Your file section, right? So it's the interaction between a patient and a doctor, right? As we said, acha. So it's very important that you get very clarify what do we mean by interpersonal skills. Interpersonal skills basically mean verbal and non-verbal communication, right? Verbal non-verbal communication, right? And it is based on these two type of communication जिसके base पे interaction हो रही है. So once you get this clear, right, this is going to be easier for you to understand किस section के अंदर क्या पढ़ रहे होंगे. So verbal non-verbal communication के अंदर we're going to have the first study. This is the first study of this section, McKinstry and Wang, right? McKinstry and Wang are going to basically look at non-verbal communication that is going to happen between a patient and practitioner. It's a very good experiment, taken it very simple, happens in 1991. What the aim is to see which doctor's clothing, right? जो डॉक्टर ने कपड़े पहने होंगे बहुत सारे type के, right? To see क्या कहते हैं, what type of clothing gives out which type of message. So as in if you wear informal clothing, कौन सा message आप patient को देते हो, wear formal clothing, कौन सा message आप patient को देते हो, right? So it is not generalizable in the sense कि it's gonna be based on Scotland. So the 475 people you have as participants are gonna be Scottish. The photos of the doctors they're gonna see are gonna be again Scottish, right? And the five hospitals that they're gonna conduct in is gonna be in Scotland. So there's a problem with generalizability, there's a problem with culture bias right off the bat. क्यों? क्योंकि whatever is appropriate or inappropriate in terms of clothing will depend upon the culture, right? Same अगर यहाँ पे करते हैं तो clothing किसी और तरीके से होना चाहिए. So this is a comparison study, so it's gonna have an IB, right? Formal clothing versus informal clothing. So if you're still struggling with the concept of operationalization, कैसे करते हैं? This is a very good example. Like इन्होंने बता दिया formal clothing के अंदर bracket के अंदर they have specified कि what is meant by formal clothing. So they have kind of operationalized it right here. If you're still struggling with operationalization, IB and DB, this is a good क्या कहते हैं example. Informal clothing can they also specify what type of informal clothing we're going to deal with. So what's happened is imagine yourself that you are one of those 475 people. You come to a hospital and they give you these photos, right? These are the exact photos that the participants see in the study. 8 photos, all in all, 3 females and 5 males. ऊपर का थोड़ा सा हिस्सा कटा हुआ है, right? Picture number A is gonna start from this side, ये जो क्या कहते हैं, the guy in the gray coat, and picture number C is gonna be this one, right? Safat coat wala. This is gonna be picture number C. So like A, B, C. Oh, sorry, I messed it up. Yeah, picture number A is gonna be the one which is in the white lab coat, right? Picture number B is gonna be the guy in the black coat. Picture number C is gonna be in the gray coat, and so on and so forth. Uh, so basically, when the people are shown these pictures, right, they are asked these questions. Take it. So ये questions पूछते हैं. Which doctor would you feel happiest seeing for the first time? As in, like, there are 8 type of doctors you're saying. So सबसे पहले, which doctor would you happy seeing for the first time? 0 से लेकर 5 तक happiness बताओ. Same thing, confidence for each of the doctor, 0 से लेकर 5 तक. So how much are you confident in Doctor A? How much are you confident in Doctor D? How much are you confident in Doctor F? So you're gonna do this for all the 8 doctors. If you would be unhappy to see any of them, which would it be? So which doctor are you, don't want to see? Which one of these doctor resembles your doctor, right? कौन सा, you can think of it in your head कि कोई doctor से आप लोग मिले होगे recently, which of them resembles your doctor. And उसके अलावा, apart from these 4 questions, there were some questions about their dress code in general, and what attitudes about, as in how they felt about their dressing. तो इसका एक अलग questionnaire. So you have this question, and you have a separate questionnaire about how people feel about their dressing. So dressing ka ek alag questionnaire. All in all, you kind of get the idea what's going to happen, right? You kind of get the idea what's going on. If you notice these pictures, right, the male doctors is the same guy, but in different clothes. And the female doctor is also the same lady, but in different clothes, right? This was done as a form of control. कि if we use different doctors in different clothing, क्या पता कि किसी इंसान कपड़े कुछ कपड़े अच्छे लग रहे हैं, तो that's why you kind of see them more suitable. तो they kind of control the factor कि हमने सबको एक ही तरह के कपड़े पहनाए, so that ऐसा कोई सीन ना हो. So सिर्फ कपड़ों की बात हो, like खूबसूरती वाला सीन ना हो. But if you guys remember कि जनरलाइजेबिलिटी का पॉइंट यहाँ पे मसला है. Point is, यहाँ पे इसलिए मसला है. अच्छा, seeing 30 different doctors, uh, this is not going to refer to the photo. These 475 people were actually seeing 30 different doctors. So these 475 people are actually real patient of 30 different doctors. That's why ये यहाँ लिखा हुआ है. So ये 30 different doctors देखने आ रहे थे ना 5 hospitals के अंदर, हमने उसको वहीं पे रोक के ये experiment करना शुरू हो गया, right? So basically उसका ये मतलब है. बहरहाल, yeah, generalizability की बात कर रहा था. See, normally हम generalizability participants के ऊपर करते हैं, right? But if you remember Pilyavin की study AS वाली, right? So Pilyavin की study के अंदर generalizability can go both ways. You can also talk about generalizability if you refer to the models in Pilyavin's experiment. याद है? 3 white male and 1 black model. ये था ना? So there was a problem in Pilyavin's experiment because, see, whether it was a drunk condition, ill condition, right, whatever it was, you're using the same one black guy all over again, right? You don't. एक तरफ तो तीन white people हैं, right? Who are drunk or ill, doesn't matter. But when you come on a black guy, black model, right? He's just only one guy. He's supposed to perform both roles. Now the thing is, you know what? There's also a problem with moral ki generalizability. Same with this. How can I say, okay, which doctor is the best if you're just using one male doctor and one female doctor? As in, I would want different female doctors, right, in different clothings. As at least the other race, when she's a white lady, so I would want a black doctor here. Same with this guy, right? I would want some other race ka doctor. So like having one doctor of each gender is also not generalizable, right? So यहाँ पे तस्वीरों के साथ भी generalizability का मसला है. I think there should be more males doctor, but they didn't do that because it was a form of control. But this control kind of limits the generalizability. There should have been more doctors in these clothing. Bharat. So this is a self-report questionnaire क्योंकि इसके अंदर कोई demand characteristics आ सकती हैं, biasness आ सकती है, right? So keep your क्या कहते हैं, mind open to that. All right. So what were the results? Which doctor did the people like best? I have a question. वो क्या है? What's the DV that we're measuring here? People's preference. Which doctor they like the best? People's preference. So that's the DV. All right. So result. Patients, right? Overall, people prefer the male doctor in a formal suit and tie. So people kind of like a male doctor in formal clothing, right? Overall. And when we talk about female doctors, people largely prefer female doctors which wore a white lab coat. So female doctor F was largely preferred in the female section, doctor section, and doctor A, B, C was largely preferred over doctor D and E when we're talking about male doctors. So formal clothing wins at the end. So this kind of helps you in the sense कि applicable भी है. You know what, if you want to train doctors के भाई खासतौर पर जूनियर डॉक्टर्स जो डॉक्टर कर एमबीबीएस के बाद डॉक्टर बने उनको सिखा सकते थे भाई इस रिसर्च के मुताबिक you're supposed to wear decent formal clothing, don't be informal. All right. There's one interesting finding कि जो higher social economics class जो status आते हैं ज़्यादातर जो अमीर लोग होते हैं ये ज़्यादातर जो जिनकी एज बहुत ऊपर सीनियर सिटीजन्स होते हैं they largely prefer doctors ठीक है ना who wore formal clothing. So the more richer you get and the more older you are, the more stronger preference for the formal doctor you're gonna have, right? इनकी reason नहीं बताया हुआ, but that's just one observation. So people from higher class, right? They don't want male doctor to wear any jewelry. For example, nowadays कोई doctor earring पहन लेगा मसला नहीं है, right? या female कोई ring पहनने मसला नहीं है. But the higher classes people, they object के भाई doctor ने कोई jewelry नहीं पहनी हो. भारत. So at the end of the day, if you compare people's confidence and ability, right, male doctor with the suit had the highest confidence level, right? And the male doctor with the cardigan, ठीक है ना, had the lowest confidence level. Same with the female with the white lab coat, 94%, 94 people confidence level. The one with the skirt, जो ये वाला H is the one with the skirt. People were not confident in that, right? So the more formal clothing you wear, the more people prefer you, and the more people will have confidence in your ability. That's the takeaway. So this is the summary of the experiment, right? A man in 5 different clothing, women in 3 different clothing. ये डॉक्टर की बात हो रही है. तो मैं थोड़ा बहुत क्लोथिंग का डिस्क्रिप्शन देना होगा. फीमेल का, female in white lab coat. G is the female in trousers. H is the female in skirt. ठीक है ना. This is क्या कहते हैं, ये जो सारे के सारे तुम बता दोगे. मेल डॉक्टर इन वाइट कोट, ठीक है ना. मेल डॉक्टर, ठीक है ना, इन अ कार्डिगन, ठीक है ना. मेल डॉक्टर इन अ जीन्स, ये ई वाला जीन्स वाला, राइट. एंड मेल डॉक्टर इन अ जैकेट. ये ट्वीट जैकेट जो है ये दो वाला बॉलर, ठीक है ना. एंड उसके बाद यू गोना गिव सम एग्जांपल क्वेश्चन के क्या इनसे क्या क्या सवाल पूछा था, राइट. ये यहाँ पे लिखे हुए. एंड उसके बाद यहाँ पर रिजल्ट तो नहीं लिखा हुआ, बट यू कैन ऑल्सो राइट द रिजल्ट. एट द एंड ऑफ द डे द पीपल prefer doctors who wore formal clothing, ठीक है ना, as compared to informal clothing. And people of higher social class and older the age, older age people prefer doctors more with formal clothing in both the genders. That's it. Is it reliable? Is it replicable? Yes. If we, if we use the exact same photos, we can conduct this experiment exactly like it is again. इसी कराची के अंदर यही सवाल रख के. So it is replicable in the sense. All right. This will lack extra क्या कहते हैं उसको, external validity for the fact that, you know what, seeing a picture of a doctor and seeing an actual doctor also makes a difference, right? तस्वीर से मैं कैसे पता लगाऊंगा है कौन सा डॉक्टर अच्छा है कौन सा बुरा है, right? In real life, I go to see a real life doctor who's physically there. So this will lack mundane realism. It's not realistic in that sense. उसके अलावा कल्चर बायस का बहुत सीन ऑन है इसके अंदर. यू नो व्हाट, फीमेल्स को के हिसाब से कौन से कपड़े अप्रोप्रिएट है कौन सा कपड़े अप्रोप्रिएट नहीं है. सेम विद मेल्स विल डिपेंड अपॉन द कल्चर. द स्कॉटिश कल्चर कुछ और कहेगी, राइट? हमारा कल्चर कुछ और कहेगा. हमारा कल्चर जो कहेगा ना, ये तीनों गलत कहेगा शायद. यू नो व्हाट, दे वुड प्रेफर फीमेल्स इन मोर क्या डोमेस्टिक सब कॉन्टिनेंटल ओरिएंटेड क्लोथिंग, जो देसी कपड़े होते हैं, मे बी, आई डोंट नो, बट या इट इज कल्चर बायस. उसके अलावा इंडिविजुअल सिचुएशन की बात करते हैं, ठीक है ना. दिस इज सिचुएशनल. इट हैज नथिंग टू डू विद द इंडिविजुअल. इट इज द टाइप ऑफ क्लोथिंग दे वेयर दैट, makes them like them or not. So it has to do with the situation. नेचर नर्चर वाला सीन नहीं है. डिटर्मिनिस्टिक वाला यहाँ पे अप्लाई नहीं होगा. नेचर नर्चर अप्लाई नहीं होगा. होलिस्टिक रिडक्शनिस्ट भी अप्लाई हो सकता है इन द सेंस कि, मकिंस्टन वैंग ने सिर्फ इनफॉर्मल सॉरी नॉन वर्बल कम्युनिकेशन चेक किया है, वर्बल कम्युनिकेशन चेक नहीं किया. So in real life, communication happens verbally, non-verbally. So McKinsey and Wang kind of ignored the verbal communication aspect, जिसकी वजह से the study becomes reductionist. कोई सवाल? अच्छा guys, मुझे 20 सेकंड दे दो. कोई नेट में इशू रहा है, मुझे 20 सेकंड दे दो, राइट? All right, we're back at it again. Okay, so this is the first study. Now, if you guys are clear in the sense that, क्या कहते हैं, non-verbal communication क्या, so we can start with the verbal communication. So for verbal communication, we have two studies. इसकी evaluation है, right? देख लेना. Verbal communication के अंदर, right? अच्छा, ये हम बाद में करेंगे, right? ये वाला जब 3 हो जाएंगे तो फिर हम ये करेंगे. So for verbal communication, right, it's also an interesting experiment. It's done by McKinley, right? तो McKinstry and Wang को McKinley से mix up नहीं करना. It's very easy to mix him up क्योंकि ये भी Scotland में, right? So okay. here's how this experiment was conducted, right? So if you guys read this sentence, right? For example, you highlight over, right? After that, can you answer me this question? What are they talking about? After you read this sentence, what do you think the word recess means? Confirming whether she is pregnant or not. All right. What? Any other guesses? ब्लड के अंदर कोई हार्मोन या कोई केमिकल अगर होगा उसको पॉजिटिव नेगेटिव वाली चीज होगी. और एक और आंसर है मेरे पास. One more answer. I'm not sure. I'm not sure either. Right? Any other guesses? I guess you're out of guesses. So, anyways, uh, so this is like kind of one of the things that the participant in the McKinley study would have to face. Scene क्या होता है कि McKinley would approach 87 families from Scotland, right? इस families का मतलब uh, people who come with their family to a hospital, right? सारे के सारे family members से नहीं करते, obviously patients से करते हैं who are accompanied by their families. So that's why family लिखा हुआ है. हालांकि it's not like that. So होता क्या है कि the scene is like this word recess, right? Recess के अलावा 56 words हैं. In total, there are 57 words, including recess, right? So these 57 words were tested, were asked to the patients, right? So इसी तरह 57 words के मतलब पूछते भाई इसका मतलब क्या है, इसका क्या मतलब, इसका क्या मतलब, इसका क्या मतलब है, and they would see whether people understood what these words mean or not mean, right? So before kind of asking the people, the doctors or the experimenters kind of divided these 57 words in like categories. अभी उनके हिसाब से कैटेगरीज डिवाइड हुआ था. इट्स नॉट द एक्चुअल रिजल्ट्स, ये तो ये इन्होंने अपनी तरफ से कैटेगरी बनाई है. The 13 words from these 57 words, right, fell into a gray area, as in these were those words जो शायद लोग के समझ में आए और शायद ना आए, 50-50, right? 50-50 चांसेस हैं कि पर्सन को समझ में आएगा नहीं आएगा. बाकी जो वर्ड्स है ना, या तो वो उस कैटेगरी में इन्होंने क्लासिफाई कर दिया जहाँ पे इंसान को 100% समझ में नहीं आएगा, या ऐसे अल्फाज थे जो 100% समझ में आएगा, राइट? अब वो वर्ड्स कौन से किस कैटेगरी में डाला हमें याद करने की जरूरत नहीं है. यू जस्ट हैव टू नो कि देयर 57 वर्ड्स, इनको 3 कैटेगरी में डिवाइड किया था. जो समझ में 50-50 आएगा नहीं आएगा, जो 100% समझ में नहीं आएगा डॉक्टर के हिसाब से, एंड जो समझ में 100% आएगा डॉक्टर के हिसाब से. बहरहाल असल में रिजल्ट क्या होता है अभी हमने वो डिस्कस नहीं किया. So yeah, so the way they conduct the experiment is, or the way they क्या कहते हैं, choose the suitability of the patient is, they interview the patient for 18 months. सबसे पहले, right? They don't do the experiment for 18 months. ये experiment नहीं हो रहा होता. The experiment happens in the fourth interview, right? So the past 3, ये जो 3 interviews होते हैं ना, चौथे interview से पहले, these were the interviews to see the suitability of the participant. So yeah, अब वो suitability of the participant वाला scene क्या है, ठीक है ना, वो मैं भी बताऊंगा. So होता क्या है, in the fourth interview का मैं बात कर रहा हूँ. Fourth interview, ठीक है ना, होता क्या है कि this is the patient in the yellow outfit, this is the doctor, and these are the exact lines that the doctor would say to the patient, right? This is not a test. The words I'm going to ask you, we are trying to find out if doctors use the word that patients understand. So we are actually testing the doctors instead of you. I'm going to explain again. अगर मैं पेशेंट से अल्फाज पूछूंगा ऐसा लगेगा कि मैं पेशेंट का टेस्ट ले रहा हूँ, राइट? एंड द पेशेंट विल बी कॉन्शियस और experiment demand characteristics आ जाएगा. So the experimenter or the doctor is kind of lying to the patient अभी. डिसेप्शन हो रहा है कि भाई मैं तुमसे अभी अल्फाज पूछूंगा ना, वो तुम्हारा टेस्ट नहीं है, मैं ये चेक करना चाह रहा हूँ कि ये डॉक्टर जो हमारे इर्द गिर्द होते हैं क्या वो सही अल्फाज इस्तेमाल करते हैं पेशेंट के इर्द गिर्द नहीं, या वो ऐसा अल्फाज इस्तेमाल करते हैं जो पेशेंट को समझ में नहीं आता, तो असल में मैं डॉक्टर का टेस्ट ले रहा हूँ, तुम्हारा टेस्ट नहीं ले रहा, ये बोलते हैं। तो ये so then they ask the word, and whatever the words they ask, whatever responses the patient give, they're recorded on a standardized form to reliability 100% high है. Ethically deception होता है, you can say, you know, but all right, all right. So अभी तक what we're discussing is, you know what, 87 families, they were asked 57 words, right, divided in 3 categories. The quiz of the words were taking the fourth interview, and the fourth interview looks something like this, right? This is what kind of the fourth interview looked like. That's it. All right, and obviously deception is the one here. All right. So when the patient will give his answer or her answer on a standardized form, the answer would be evaluated by 2 doctors, right? The 2 doctors don't know कि दूसरा इंसान भी स्कोर कर रहा है. As far as they're concerned, they are the only one scoring. इसलिए करते हैं ताकि you know what, you don't realize कि someone else is scoring the same thing as you, so you don't, your scoring doesn't get biased. At the end होता क्या है कि this person scoring and this person scoring आपस में compare करते हैं to see, you know what, क्या दोनों लोगों ने same चीज same तरीके से score की है, इस score के अंदर ऊपर नीचे आता है, so inter-data reliability बढ़ा देते हैं, right? But so what are the scoring? Basically जो भी responses तुम दोगे ना sheet के ऊपर, right? Whatever your responses, you have a question. So the previous 3 interviews mean to get general idea of patient. Yep. I'm gonna get to it. अब उसका टाइम आएगा, मैं बताऊंगा 3 इंटरव्यू का सीन क्या है, मैं बताता हूँ. क्या कहते हैं, हाँ. Alright. So basically होता क्या है, so the doctors, right, ये जो रेटिंग देते हैं, right, whatever क्या कहते हैं, response you give, right, whatever response you give, तुम्हें कोई ना कोई ग्रेड दिया जाएगा, A B C D, right? It's the opposite of Cambridge. You want a D grade in their test, right? You don't want A grade in their test, right? So in case after the D grade was the best patient, right? जिसको सब कुछ मालूम है. And the A grade was the worst patient, जिसको सब कुछ नहीं मालूम, right? So इस चीज़ का ख्याल रखना. They divided people into 4 categories, जो भी उनके answers होते हैं, right? A is the one जिनको कुछ समझ में नहीं आ रहा था. B is the one, ठीक है ना, जिसको क्या कहते हैं, लफ्ज तो पहचान लिया, लफ्ज पहचान तो लिया, लेकिन मतलब समझ में नहीं आया. ए के अंदर ना पहचानते हैं, पैदा हुआ सुना है, और ऑब्वियसली जब पैदा हुआ सुना है तो समझ में नहीं आएगा. बी का ये है कि भाई सुना, क्या कहते हैं, सुना हुआ है लेकिन मतलब गलत पता है, राइट, लाइक दे काइंड ऑफ मिक्स अप द मीनिंग. सी का मतलब है दे आल्सो रिकॉग्नाइज द वर्ड बट दे डोंट नो द मीनिंग एट ऑल. तो यहाँ पे कोई ना कोई मीनिंग है, बट द इनकरेक्ट वन. सी के अंदर मीनिंग बिल्कुल ही नहीं है, सो काइंड ऑफ थोड़ा बहुत डिस्टिंक्शन है यहाँ पे. D is the one where you know the word and you understand the word, right? So basically you want to end up in the D section. All right, so
Sir,
yeah,
can you explain the B and C one again?
Zabardast, no problem. So yeah, so basically the word recess, right? Imagine yourself as a participant in the study. If you're given the A grade, you're gonna be the person who says, "Okay, you know what, I have never heard recess before, and I don't even know what recess is." You're gonna be the A person. B, B is the person who has heard recess before. So now what? But their meaning is completely wrong. Right? I don't know. You guys took guesses, right? Hormone, pregnancy. If it's the incorrect definition of the word, right, then you might be a person who's in the B category. C is the person who also has heard this word before, but they have no idea what this is. B has some idea, but it's the wrong idea. C has bilkul no idea what this is. The common thing between B and C is that they have heard this word before. So ये दोनों ने सुना हुआ है. The difference point between B and C is that B is wrong in its definition and C doesn't even have the definition. C will have मुझे नहीं पता, सुना हुआ लेकिन नहीं पता. So that's the idea. But uh, yeah, so after they do this entire thing, right? ये पूरा का पूरा जो हरकत करते हैं, 1 year passes. After 1 year, what happens? Uh, After 1 year, what happens? That you know what? They call in the people again, right? Obviously, they call in the people again. Acha. So basically, you know the three interviews that were being done. Okay. The three interviews that were being done to was all done for this thing. ये वाला डब्बा है. Basically, they were kind of gathering the information to classify you as a utilizer or underutilizer, right? So, yeah. In the three interviews, डॉक्टर को पता चल जाएगा कि भाई आप हॉस्पिटल ज़्यादातर आते हो, you're a utilizer, या आप हॉस्पिटल बहुत कम आते हो, underutilizer, right? So the first three interviews were used to classify you into two distinct groups. This is the IB. Utilizer and underutilizer is the IB, right? So the first three interviews were to do with that. Okay. Now, hota kya hai? The DV is what grade you get, if it makes sense now. If the pieces of the puzzles are fitting, right? So the DV is the responses or the comprehension of the participants, right? Now, ab hota kya hai? Doctors ने अपनी तरफ से अंदाजा लगाया होगा भाई ये औरत नंबर 3 है और ये अंडर यूटिलाइजर है, तो you know what, right before the experiment even begins, experiment शुरू होने से पहले I'm gonna assume that she's gonna fall into the A category. Same thing, I have a man who's 60 years old, right? गांव से आया, अनपढ़ है, he doesn't come to hospital क्योंकि गांव से, he's an underutilizer और अनपढ़ है. Whatever I'm gonna ask him, I bet कि ये A category के अंदर fall होगा, right? So the doctors have their assumptions as well. ठीक है, डॉक्टर का अपना assumption पहले से ही बना लेते हैं before the interviews begin. अब होता है क्या, ये वाला इंटरव्यू कर लेते हैं, अब लोग कैसे आंसर सामने आते हैं. So at the end of the day, what they're doing is they're comparing their prediction of the utilizer slash underutilizer with the actual answer of the utilizer slash underutilizer. ठीक है. Now we want to know how correct are doctors' predictions. Are they right or are they wrong? So, hota kya hai, at the end of the day, right? The doctors kind of क्या कहते हैं, the male doctor खास तौर पे kind of underestimates female patients, right? So that's one key variable. The male doctor is taking a kind of females को lower grade देता है in the prediction, लेकिन असल में female score a higher grade than his prediction. ठीक है ना? Number 2, yes, obviously the utilizers होंगे, right? They got the most answers right as compared to the underutilizers. So ये तो common result आना ही था, right? Overall, when you compare the actual scores of the people versus the expected scores of the doctors of the patient, you will find that largely, the doctors kind of underestimate the patient's ability to understand words. So, in large context basis, people will be able to understand medical terminologies more than the doctor's expectation, right? So that's the entire takeaway. Male doctors kind of underestimate females, and doctors underestimate females entirely overall. And yes, those who use the क्या कहते हैं, medical services will be able to understand more words, right? These are the three takeaways. All right. So अब मैं तुम्हें पूरा तुम्हारा दुआ बता दूं, right? 87 families, right, come to the interview for three times. When they come to the interview for 3 times, the three interviews are used to classify them into two groups, utilizers slash underutilizers. And the three interviews are used to kind of make the doctor's prediction कि डॉक्टर को भी आइडिया हो जाएगा कि इसके अंडरस्टैंडिंग किस तरह आएगी, right? उसके बाद एग्जैक्टली 1 year passes फ्रॉम द इनिशियल इंटरव्यू, राइट. फिर ये एक क्विज करते हैं, ये वाला क्विज करते हैं. क्विज करने के बाद फिर ये इंडिपेंडेंट रेटर्स इनके रिस्पॉन्स स्कोर करेंगे. स्कोर करने के बाद यू कंपेयर एंड यू गेट दिस रिजल्ट. ये मीटिंग एंड हो रही है. आई एम गोना रीस्टार्ट दिस मीटिंग क्योंकि जूम का टाइम लिमिट अप हो गया.